Well, this will be the first in-person briefing in months, and this is happening because health officials say they have a very important message for the public that they want to get out there, especially ahead of the holidays. But first, let's take a look at some of the latest numbers for LA County. Take a look. This was just released. LA County now reporting 4,353 new cases of COVID-19, 10 new deaths linked to the virus, and more than 1,100 people are hospitalized currently. The positivity rate is more than 13%. Now, overall, health officials believe these numbers only reflect a fraction of actual infections in LA County, considering most people take the test at home and don't report it, and others don't get tested at all. Health officials say you should still consider wearing a mask, especially indoors, and if you are immunocompromised, and if you believe you have been exposed to the virus in the last 10 days. Public Health has been talking about a possible surge, warning about this for months leading up to the holidays and winter months. Getting the vaccine now and staying up to date with the latest booster shots is your best bet, according to doctors. Additionally, flu cases are on the rise. Also, RSV cases are on the rise, especially amongst children.
The thing that we really want to make sure that we do with such high rates of virus circulating in the community is to make sure that we protect ourselves, protect people who may be immunocompromised.
And we expect to learn more about the new warning from public health officials. That meeting expected to take place at 2 o'clock today. But that is the very latest. I'm Lena Bourbon reporting live here in Mission Hills, KTLA 5 News.
LA County's top public health official is sounding the alarm, saying the spike in COVID-19 cases could send the county back to an indoor mask mandate. Right now, the county is at a medium level of transmission, and it could move to high by next week. The county has had an average of 192 hospital admissions per day. That's an increase of 200% in 1 month. The average number of hospitalizations per day is 2,700. That's up from 1,500 from November 17th.
So again, we would need both of those metrics to also be at the high level, along with our case rate to be at the high level. And then we would go ahead and follow the CDC guidance, which includes universal indoor masking.
Dr. Ferrer says both flu and RSV cases are also high, although she says RSV seems to have peaked. Tragedy now on a local campus. A man
says flu levels here in California are off the charts, and LA and Southern California lead the state. There are 10 other states with high infection rates. 25% of people in Los Angeles tested for the flu are testing positive. The problem is made worse because of a surge of respiratory virus and COVID cases.
As COVID cases and other viruses continue to rise, the Southland is inching closer to a mask mandate. Experts say the combination of COVID, the flu, and RSV is putting an enormous strain on state hospitals, especially children's hospitals, which have seen an influx of RSV cases. But even with viruses on the rise, one expert says reinstating mask mandates should be a last resort.
I think there's very little political appetite to do this, and we're going to try to not do it as much as possible, for the season.
And he says LA could see a mask mandate return because of city thresholds. The good news is we've learned how to protect ourselves with masks, vaccines, and treatment if you do get sick.
It's really scary. It's very, very scary.
Hilda Badhumian heard about increases in COVID cases in the Southland and is getting her booster. Only 35% of California's vaccinated seniors have gotten updated boosters, with even lower rates for younger age groups. She wants that immunity boost before holiday gatherings.
And I don't want to get sick, especially family and my grandkids.
Arden Medical Pharmacy says it's been getting more people coming in for vaccinations, both for COVID and the flu, which has started hitting the Southland hard as well.
It is recommended they can get both at the same time. We don't push it if they don't feel comfortable. We let them do it a couple of days apart from each other, but it is recommended and there's no harm of getting both of them at the same time.
Pharmacist Kambiz Farzam says he continues answering questions about vaccine safety, but because so many COVID vaccine doses have been given, those have decreased. He says folks are also usually relieved to know side effects tend to lessen with each booster.
There's less side effects and people are getting used to it because they already had a couple of shots in their body, so there are less side effects with this compared to the first two.
Orange County hospitals are also seeing lots of people sick with the flu and COVID right now, and like their LA County peers, are urging vaccinations.
About 50% of the patients we're testing for COVID are positive. Most of the people that we are testing for both viruses haven't been vaccinated. And so, it doesn't surprise us that they're coming in sick.
Los Angeles County is considering reinstating an indoor mask mandate as COVID cases there continue to rise.
Last week, health officials said it would only happen if the county reaches high transmission levels. Right now, they are at medium. Health officials say the county is averaging more than 2,100 new COVID-19 infections per day, but they say the number could be much higher because many people do not report results from at-home rapid tests.
For more, let's bring in Dr. Jerry Abraham. He is the director of Kedron Vaccines at Kedron Health. That's where I got my first shots, I have to tell you, Dr. Abraham. First and foremost, what's driving the case numbers up, and how much worse do you expect it to get?
Yeah, we predicted this, that we would gather for Thanksgiving and the holidays. The weather's getting colder. And so we're huddled together. And of course, that's a perfect environment for these bacteria and viruses to spread, really be contagious. And so we really, saw this coming in some ways. And so we just really have to make sure that we're prepared for it.
So there are also fears that we're nearing what people are calling a triple-demic, which includes the flu, COVID, and RSV circulating at the same time. What are you experiencing firsthand in your hospital, and how severe do these cases seem to be?
Yeah, so this is this triple-demic, RSV, COVID, and flu. And so it's just this perfect storm of pathogens that can affect different people differently, including our elders or those that have underlying medical conditions. And so really you've got sometimes older folks or sicker folks getting hospitalized for the flu. You've got kiddos getting hospitalized for RSV. You've still got COVID in the background, and that takes up beds, and that really does back up whether or not we can get people upstairs, whether our emergency room gets crowded, and really how we're going to triage that. And also knowing that we also have to always be ready for people that have heart attacks or trauma. So it really is a balancing act.
So with that in mind, and with these diseases all having overlapping symptoms, what do you do if you get sick?
Right. I think it's very important to know when to go to the emergency room. I think it's always wise to call your doctor's office, the clinic that you go to, and get some advice. Generally speaking, with children, if they're acting lethargic, their behavior has changed, they're less fussy than usual, those may be signs that your kid needs to be evaluated further. We're always concerned about heart rate and respiratory rate, how quickly or how slowly you're breathing. Things like if they look more bluish, their fingertips or their lips, those are ideas that they may not be getting enough oxygen. Those kids should be evaluated in an emergency room.
Well, Dr. Jerry Abraham, thank you. Did you hear that, Vlad? It's normal for kids to be fussy, just so you're prepared.
I'm prepared. I'm prepared for that. Doctor, thank you very much. Appreciate it.
Thank you.
Speaking of rising cases, LA County is moving closer to bringing back indoor mask requirements. Health officials reported more than 10,000 new cases over the weekend, including more than 5,000 on Saturday alone. And officials fear the real numbers are likely worse because people are testing at home. So here's what it would take for the county to bring back mask requirements. First, we would have to average 200 new cases daily for every 100,000 people. And as of last week, we were averaging 185 new daily cases. Then the rate of daily COVID positive hospital admissions would have to top 10 per 100,000 people. And the percent of hospital beds occupied by COVID patients must top 10%. All three of those things would need to happen to bring back masks. But health officials estimate that could happen as early as the beginning of January.